Hello and welcome to the program. I'm Teniola Shobowale. The coronavirus pandemic has been confirmed in over 180 countries globally since it was first discovered in the Chinese city of Wuhan in late December 2019. All except 2 African countries have recorded cases as governments roll out measures to combat the spread. Across Africa, the current figure stands at 18,743 cases. Egypt has now surpassed South Africa as the country with the most cases on the continent, with 2,673. South Africa currently has 2,605 cases. Morocco is now the 3rd country with the most confirmed cases, with 2,528, after surpassing Algeria, which has 2,268. Meanwhile, 970 people have died, an increase of 58 from Thursday. The countries with the most fatalities are Algeria with 348, Egypt 196, and Morocco with 133. At least 4,379 people have recovered from the coronavirus on the continent. Although these rates are far lower than those seen in parts of Europe and the United States, the World Health Organization says Africa could become the next epicenter of the coronavirus outbreak. The WHO says the virus appears to be spreading away from African capitals. It also highlights that the continent does not have enough ventilators to deal with a pandemic. The organization's Africa director, Dr. Mashidiso Moeti, says the focus now is on prevention rather than treating the virus because African countries don't have the capacity to treat many coronavirus patients. On Thursday, the World Health Organization said coronavirus cases in Africa could surge from just thousands now to 10 million within 3 to 6 months, according to provisional modeling. Malco Yao, head of emergency operations for WHO Africa, says it was a tentative projection that could change and notes that worst-case predictions for the Ebola outbreak had not come true because people changed their behavior in time. Infections in South Africa, which has seen high numbers, have slowed after it began a strict lockdown. But other nations, such as Burkina Faso, the Democratic Republic of Congo, and Algeria, have seen higher than average fatalities. Well, the Africa Centers for Disease Control and Prevention plans to distribute 1 million COVID-19 test kits from next week to help countries across the continent address a testing shortfall. Although official figures show that Africa has so far been hit less hard than other continents, experts say limited testing in many countries has deprived officials of a full picture of the disease's spread. Africa's CDC Director, John Nkengasong, noted that the problem was especially apparent in the continent's 2 most populous countries. Nigeria, with nearly 200 million people, has conducted about 6,000 tests, while Ethiopia, with more than 100 million people, has conducted about 5,000. He adds that over the next 3 months or 6 months, Africa will probably need like 15 million tests. Meanwhile, over in Cameroon, 996 cases and 21 deaths have been reported, but many fear the real number of confirmed cases is more than 1,000 due to a lack of testing. In one district, 500,000 people there, are only 2 medical teams who checks on potential patients.
A team of doctors in Douala, the commercial capital of Cameroon, check in on a 32-year-old woman after she alerted authorities of experiencing coronavirus symptoms. Dr. Landim Vele and his small team are tasked with responding to calls and carrying out tests on locals who suspect they have contracted the virus. The mother of 2 who made the call is told to self-isolate in a separate room to her children and find assistance for their care during a 3-day wait for her test results. Members of the field response team then also sprayed the house with disinfectant. The Center for Disease Control and Prevention, CDC, in Africa says not enough testing is being carried out in sub-Saharan Africa and that there is a big gap on the continent. One potential COVID-19 patient who called the Douala health team after feeling unwell says he was worried because he travels a lot and shares public transport with other people.
Vous savez, pour une pandémie comme celle-ci,
you know that with a pandemic like this, you will find that a lot of people don't have the courage to get themselves tested and to present themselves. They don't have the courage to go to the authorities after getting one of the symptoms or several symptoms.
But Dr. Vele says attitudes have started to change and health teams are getting more calls from concerned residents.
It is true that at the beginning, people were very skeptical. But now, it is starting to get easier, and everyone is getting with the program. Everyone wants to eradicate the epidemic. Every person, every Cameroonian today is conscious of the fact that the coronavirus is a deadly disease. It is a disease which kills.
Up to 23 medical staff have been infected since the start of the outbreak in Cameroon. There are only 2 medical teams in the district of Bonasama. Around 500,000 people live in the district, and officials say the workload is too heavy for them. Cameroon this week made the wearing of masks in the streets and on public transport compulsory. But as with many countries, there are not enough surgical masks at the pharmacies, so local non-governmental organizations like Human Rights in Africa are sewing their own and distributing them for free.